Elizabeth Junak. I'm the Director of Clinical Services with Onslow County Health Department.
Carol Halliday, Interim Director of Home Health and Hospice at Onslow County.
Okay, so I was hoping you guys could tell us a little about the need for a hospice and the need for hospice care here in this county.
Well, there's always a need for hospice because, we're all born and we all die. And end-of-life care is very important.
So what we realize is that there's times that patients and families get a little tired, and hospice care and inpatient hospice care can help them with some abilities to have some downtime, to re-energize their batteries, to get some perspective of what's happening in life and in death. So it's a way to give some breaks to the caregivers, which when you're in the middle of that whole process of death and dying and needing to care for a loved one, it can take you all your energy. It zaps your energy. You lose focus. You start just focusing on the patient. You forget about yourself, and you don't always. It's not always healthy. So we're trying to provide a healthy environment.
And you guys work with patients from all over, not even just Onslow County, right?
Correct. We do the outskirts. We Carteret, Jones, Pender. We're all about around the outskirts there.
So can you describe in what situation you would recommend somebody to seek treatment at a hospice house?
Well, generally, we use a hospice house for two different things. One is for respite, and the other reason we would utilize an inpatient hospice is for inpatient care. If they had uncontrolled pain or something, maybe wound care that the family could not perform, we would get them admitted into the inpatient hospice house. If the family needed the rest to be able to go on vacation, or if the patient did not have anyone to care for them, then we would put them in the residential side of the hospice house.
And just to clarify, that's not a hospice house that we currently have in Onslow County.
We do not have a hospice house in Onslow County.
Okay. And what kind of need do you see for a hospice house in this county?
It would be wonderful to have a hospice house here. There are families that are staying in Onslow that are retiring here. We have the baby boomers that are
Retirement age.
Yeah.
Hitting
So
it.
we are starting to see that increased amount of our population that will probably need that in the future.
And in terms of referring them to other hospice houses, how often do those?
Doesn't happen as often as we would like. It's a sick patient, and a lot of times you don't want them that far away from home. And closest right now is in Carteret County, so would be 45 minutes to an hour ride. And it's hard to leave a loved one, even though you're putting them in a hospice house and you know they're safe. There's times that you want to be there, or something happens. You want to not have to worry about driving in the middle of the night an hour away to get there. It's a long ride, so sometimes it doesn't get used as much as it should be because of the distance. So we get referrals from the hospital. Someone might wind up in the hospital, and the family has talked to the doctors, and they've decided that maybe this is an end-of-life issue and that they need hospice. We also get referrals from physician offices. Family members sometimes reach out to us. They come by the office, or they'll give us a call to ask questions about hospice and when is it time to utilize hospice. And as we said before, sometimes it's better to try to get that all arranged sooner than later, because we can provide the more comfort care that someone would need at the end of life, and the support that the families definitely need through this difficult time, because it is a very difficult time.
And if someone is interested in finding a hospice service, what is the best way to reach you guys?
I think you can look on our website, but calling is always the best. We have a team there that's been there, some of us for 30 years, and they know the ins and outs of hospice, and really would do well to talk to someone, because we would come out to your home. We have a really good social worker she's an expert, and also our support staff in the office know all about our hospice program, and we'd be more than happy to talk.